Hello and welcome to today's session. Today's session, we are looking at the history of gynecological nursing. Okay, gynecological nursing. So, when you talk about history, what comes in your mind, guys? Guys, we have the father of history. Okay, and the father of history is referred to as Herodotus, and he is traditionally regarded as the father of history because he was the first historian to collect and systematically document events and create an account, and that's why he is referred to as the father of history. But when you come to gynecological nursing, we have the pioneer of gynecological nursing, modern gynecological nursing, and is referred to as Mary Sickle. She was a Jamaican, okay? She was a Jamaican, and he did tremendous job. This was just after the Florence Nightingale work in the during the Crimean War. So she did a great job. So when you look at the history of our key subject, which is gynecological nursing, of course, in this review, we are going to be looking at the world historical development, but we'll be having a bias to Kenya. Kenya is our country here, so we have to pay more attention to it, and that should be understood by the audience, maybe outside Kenya. So the historical events in gynecological nursing have undergone significant transformation over time and time. And in recent times, you find that when you compare it with the ancient times, the old times, during the old times, women's health was often managed within communities, and we could have the midwives playing a key role in the childbirth and the women's health. So historical events suggest that the traditional birth attendants and midwives were very integral in providing care during childbirth in various culture, including those ones from Africa, where Kenya belongs. So we had another factor that really influenced the growth of gynecological nursing in Kenya, and that was the colonial influence. And this happened between the late 19th century and the mid 20th century. Okay, so during this period, we find that Western medicine began to influence healthcare practices. So missionary hospitals and clinics played a role in introducing modern obstetric and gynecological practices. So we had formalized nursing education, which started in the colonial area and often with a focus on basic maternal and child health in Kenya. Remember, we had the King George the Sixth Hospital. Currently, if you come in Kenya, this facility was renamed Kenyatta National Hospital after Jomo Kenyatta, and Jomo Kenyatta was our first president. Okay, this is immediately we gained independence from the British. We changed the name to reflect Kenya. From there, we had the post-independence, and the post-independence happened in the 1960s onwards. So after Kenya gained independence in 1963, there were some efforts that were made so as to strengthen the healthcare system, including women's health services. I think this is the best time for the flashback, guys. When Kenya got independence in 1963, the pioneer president Mzee Jomo Kenyatta declared war on three key issues, and these issues were poverty, diseases, and ignorance. I can tell you, we are still fighting with the same, and maybe with time we are going to overcome this. So the expansion of nursing education and the establishment of formal nursing schools contributed to the professionalization of nursing care in gynecology. So the involvement of Kenyan nurses in these women health initiatives and family planning also increased. So from there, From the colonial area, we go to the HIV AIDS epidemic, and this happened within the 1980s and 1990s. Of course, we know that this one was declared a global pandemic on June 27th, 1981. And in Kenya here, in 1999, it was declared as a national disaster. I can tell you the prevalence as per the 2000 statistics was around 13.4%, and this uh, this led to the formation of a task base, and that AIDS Council has really come up with several programs that have at least moved the country's prevalence, or that's reduced for that matter, from 13.4% in early 2000s to around 6.9% in 2006. And I'm sure the statistics have gone low because of the efforts that this council has done. So the emergency of HIV/AIDS epidemic in the 1980s had profound impact on gynecological nursing in Kenya too. So nurses became so essential in the prevention, management, counseling related reproductive health issues, including mother to child transmissions. So we've been having the 90 to 90 treatment for all. Um, we say that by 2000 we were aiming that 30 million people should be on treatment 2020, and 90% of these people living with HIV should know their status. 90% of the people who know who know that they are HIV positive, they should be on treatment, and 90% of these people on treatment are supposed to be virally suppressed. We keep on reviewing these goals so that they are able to reflect the current times for us. Okay, so we have to know the 90. Okay, 90 have been identified and they know their status. 90 they have been put on treatment, and 90 of them should be virally suppressed, the 90 rule. From there, another factor that has really significantly improved the gynecological history in Kenya is the focus on maternal health. Maternal health refers to this the health of women during pregnancy, child health, and postpartum period. So we have to ensure maternal health is crucial so that the well-being of both the mother and the child is guaranteed. And we have several components ranging from access to quality health services, prenatal care, safe delivery practices, and postpartum support. So in the 21st century, there has been a global emphasis on improving this maternal health, and Kenyan nurses have played and continue to do a crucial role in achieving these goals. So efforts to reduce maternal mortality rates have been involved. Training of nurses in emergency obstetric, family, and antenatal care. So we are working on prenatal care, safe and delivery care, family planning, emergency and obstetric care, nutrition, postpartum care, maternal and mental health, education and empowerment, and come up with some global initiatives, okay, such as the United Nations Sustainable Development Goals, the SDGs, which include targets related to maternal health. So SDG number 3 aims to ensure health lives and promote well-being of all, including reducing maternal mortality. Another initiative is the community health and midwifery. So they have become increasingly important with nurses actively engaging in outreach programs. So in these programs, they do educate women on reproductive health and promoting family planning. So these midwifery services have gained recognitions, and efforts have been made to integrate midwifery training into nursing education. So we have a number of universities in Kenya that do provide and offer degrees, diplomas, and certificates in this community health and midwifery. We also have technological advancement that have really shaped the growth and history of gynecological nursing. So advances in technology such as the introduction of the ultrasound, obstetric ultrasound, and other like Doppler ultrasound for the DVTs, and Other diagnostic tools, this has really influenced gynecological nursing practices in Kenya, improving the ability to provide quality care. We also have professional bodies, professional organizations, and the involvement of these Kenyan nurses in professional organization and advocacy groups has also contributed to the recognition of gynecological nursing as a specialized field. We have had ongoing efforts to focus on continuing education, research, policy development just to enhance women's health care services. Organizations such as the KMA, Kenya Medical Association, whose major focus is medical associations with a focus on women's health, including gynecology. We also have the COGS, Kenya Obstetric and Gynecological Society. This is dedicated to obstetrics and gynecology. The Nursing Council of Kenya is a regulatory body for nursing practice, and it's relevant for nurse in women's health. Ensures that only competent nurses are the ones that have been given the authority to take care of women with such challenges. We have also the CAS, the Kenya Association of Clinical Cytology. It promotes clinical cytology, which is relevant to gynecological health, especially the cervical cancer screening. And lastly, we have Kenya Medical Women's Associations, the KMWA, and this brings women healthcare professionals together, including gynecologists. This is so as to address women's health and issues. So, guys, the history of development of gynecology in Kenya reflects a journey that has been marked both with challenges and advancements. So, over the years, the country has witnessed significant progress in maternal health care, women's reproductive rights, and the overall understanding of gynecological issues. So, from the early influences of traditional birth attendants to the integration of modern medical practices, Kenya has made strides in improving women's health. So the establishment of professional organizations like the one that you mentioned, the COGS, the KMA, this would demonstrate a commitment to advancing the field of gynecology. This organization do play crucial roles in fostering research, advocating for best practices, ensuring continuous professional development for healthcare practitioners specializing in women's health. However, challenges persist, including issues related to access to okay, quality healthcare, maternal mortality, and socio-cultural factors influencing women's health decisions. So to move forward, it is imperative to address these challenges through comprehensive strategies that involve collaborating between governmental or institutions, healthcare professionals, non-governmental, and the community at large, so as to really take care of these gynecological conditions. Thank you so much and see you. Kindly remember to take a quiz just to test your knowledge on the history of the development of gynecological nursing in Kenya.